it's Chelsea Peters. I am a registered nurse, and I am currently enrolled in Austin Peay's RN to BSN program, and one of the classes that I'm in is a community assessment class, and they had us last semester do a full windshield survey of Dixon. So we learned all about the different things going on, everything that Dixon even struggles with, or that are our strengths. So in this segment, I'm going to talk about cerebrovascular disease, what it is, the signs and symptoms, how is it diagnosed, the treatments, how to prevent it, the prevalence of it in Dixon specifically, and it's actually quite prevalent in the state of Tennessee. It's actually for 2020 going to be considered one of the top 5 reasons of death. So I wanted to touch on this topic because it is so prevalent in so many areas, with a lot of ways to modify and reduce the prevalence. So it took second place in the circulatory diseases, causing 25.7% of deaths in the last year. So anyways, we all know that in the last century that the age range is getting older. For Dixon, the expectant life expectancy is 75, almost 76 years old. So quite a bit over that 65-year-old age range. And that's where we start seeing more chronic illnesses. Used to, people would pass away from infectious disease and things like that. Now that we're older, people are passing from more chronic diseases such as cerebrovascular disease. So anyways, I'll just kind of talk about what I've got on this board here and let you know what all I know. So cerebrovascular disease, it's also known as a stroke, cerebral infarction, or a brain attack. It includes all disorders in which an area of the brain is temporarily or permanently affected by ischemia or bleeding, and one or more of the cerebral blood vessels are involved in the pathological process. It's sudden impairment of cerebral circulation in one or more of the blood vessels that are supplying the brain. It includes stroke, carotid stenosis, vertebral stenosis, and intracranial stenosis, aneurysms, and vascular malformations. So quite a range of different things going on. There are 3 different things I've got highlighted here. These are really kind of the biggies. So there's a thrombotic way of reducing blood flow to the brain, and it causes slow evolution of symptoms, usually over several hours, and is completed when the condition stabilizes. Embolic, that's when a clot is carried into the cerebral circulation and causes localized cerebral infarct. Then there's hemorrhagic, so it's almost on the opposite side of this, but it still reduces blood flow to the brain, and it's caused by conditions such as aneurysms, high blood pressures, arteriovenous malformations, and other bleeding disorders. So just the vessels get too weak in the brain, and that pressure makes them too weak and causes rupture. All these disruptions in blood flow cause transient or permanent effects. The sooner that circulation returns to normal, the better chances for complete recovery. So I did read that 50% of the survivors of a stroke actually have long-term deficits. So the sooner the better, for sure. There are a few things, several things actually, that are risk factors. So those with high blood pressure or hypertension, older age greater than 65 years old, which is more common now. Family history, obesity, physical activity, smoking, diabetes, atrial fibrillation, high cholesterol, gender, males at a higher risk, and hormone replacement therapy. So some of these are modifiable, some of them are not. So you can't modify your age or your gender or your family history, but majority of things are modifiable, and we've got different interventions later on that can help with modifying that. So signs and symptoms, these are some big things that we've all learned about, especially if you have asymmetrical face, some drooping, arm weakness or leg weakness on one side or the other, speech problems, it's time to call 911 because we need to get on getting that CT scan. You can also have dizziness, nausea, and vomiting, a severe headache, confusion, memory loss, numbness, tingling, weakness in an arm or leg, like I said. Difficulty with comprehension and vision can be difficult, and then a loss of balance, coordination, or even the ability to walk. So if you have any of these, obviously call 911. In the city of Dixon, we've got TriStar Horizon, and they are stroke certified. They've got the CT capabilities and all that, so they are able to manage stroke care. So that's really a good resource for us here in Dixon. So there's the diagnostic process. So obviously, as I said, CT scan. There are things such as a cerebral angiography, MRI, MRA, Doppler of the carotid, or Doppler ultrasound, carotid ultrasound, EEG, and lumbar puncture are all different ways that it could be diagnosed. So then treatments, medications typically can be used in a patient if they have about 50% or less of the vessels that are blocked or narrowed. So hopefully medication, that would be the first go-to, but if it's a more severe case, it may need surgery, such as removing plaque or blockages, or sometimes inserting a stent to open up that vessel and allow blood flow to get there. And then, of course, later on, you might see someone needing physical, occupational, or speech therapies, and those can all help regain some abilities, but typically that's on those patients that have those longer term issues that come from these strokes. So also, when it comes to the treatments and stuff, we've got ways of modifying things. The American Heart Association shows us Life's Simple 7. So that mainly consists of managing blood pressure, controlling cholesterol, reducing blood sugar, get active, eat better, lose weight, and stop smoking. All things that we know pretty much throughout all disease processes can improve a lot of stuff. So this is good really for any kind of disease that you would approach. So then we've got the nursing diagnosis for this disease process for a community. I went with risk for ineffective tissue perfusion related to interruption of blood flow, as evidenced by 34.4% of overweight residents in Dixon. Then there's also 38.5% with hypertension, and 22.6% are smokers, all in that risk category. So these are all things that we can definitely modify just by improving and doing the Life Simple 7. So interventions. For a nurse, it would be provide education on cerebrovascular disease process, check vital signs daily, especially on medications, weigh once a week, especially if you're doing diet and exercise. You should see results within that week that you're probably starting to notice a difference. Also, assess the level of understanding about medications and the disease process, because some people get a little bit confused and may not realize what they're supposed to be doing. Provide community health fairs, pamphlets, and posters, trifolds, these kinds of things all can help the community understand more of what's going on. SMART goals. The community of Dixon will decrease residents with cerebrovascular disease in 1 year after education is complete. So definitely reachable, just have to get the education out there. The community of Dixon will see a decrease in overweight residents 6 months after healthy diet, education, and increase in their physical activity. And then the community of Dixon will report lessening hypertension percentages 6 months after education performed. So definitely all reachable. Like I said, we just got to get that information out there. So anyways, that's what I've got. There's lots of resources to turn to, such as the American Heart Association and things like that. So don't ever be afraid to ask.